In every human being, there is a story that needs to be heard. For those who are homeless and living on the streets, there is an undeniable sigh of relief, a newfound gaining of ground when a doctor, social worker, or volunteer becomes a part of their world. We live in a county where agencies and their staff charged with helping those who are homeless go well beyond their own job descriptions every day to learn the names of each person they encounter, hold their hands, and above all, listen. These are the champions whose expertise, support, and connectivity during the time of COVID-19 and beyond is helping to redirect and support a new path for the unsheltered homeless. Here is their story.
We don't have a homeless problem, we have a housing problem. And when we recognize them and see them as people and we do try not to ignore them, it makes a huge difference for them. To have them feel respected as people, to have them feel that people care about them. There's an old saying that people won't care how much you know until they know how much you care.
We're out here today under the Crosstown Freeway working with individuals to get COVID-19 testing. We've been out here for the past 8 weeks doing intervention and prevention and education, empowering those who are unsheltered with the knowledge of COVID-19 and how to prevent the spread of disease. I'm proud to say the hard work and efforts and late nights that we've been out here has resulted in over 200 individuals being tested, and not one of them is positive.
The homeless patients don't have the ability to socially distance, and sometimes they're also behind on what information is coming out in the media and in other outlets, and so need to get the similar education as the rest of our patients in the community. And in effect, testing the homeless patients helps the entire community as a whole. If we can help these individuals be tested and isolate them early and protect them, it will help the society and our own community as a whole much better.
This is a group of individuals that are vulnerable. They really are at high risk for a number of different health conditions. And with their living environment, it makes it even more important to ensure that they get the screenings, the assessments, the education that they need, all to ensure that they avoid any type of transmission of conditions such as the coronavirus, and as well get the treatment that they need if they do test positive for COVID-19.
People often ask me, why are you emphasizing the work on the homeless? And we tell them because homeless are people and they're part of this community, and I work for everybody in this community. Many of those out here just need a helping hand and need some assistance in order to get back up and stabilized. Those include behavior health and assistance with counseling, substance abuse disorder, and supportive measures for that. Temporary housing with the goal of getting them into affordable permanent housing, as well as addressing their physical needs. We have a lot of seniors out here with advanced stages of cancer and diabetes where they've lost limbs, high blood pressure and COPD. We need to address those issues as well.
It's just as important to make sure that we don't lose the momentum that we have now going with working with the homeless population, and that we bring as much of the medical care that we could possibly bring to them out in the field. So yes, we do have clinics around the county. There are a number of organizations that have clinics, but access is an issue. Transportation is an issue. Awareness and just the feeling that they could actually comfortably come to clinics for care, it's very different than your average person, right?
Knowing that COVID's part of our lives right now, I'm very pleased that they do the testing on everybody coming in, and they will stop people who have a high fever or coughing or just aren't feeling well for whatever reason. And so I'm very pleased with the testing that they do.
And the corona, it's great that they came up with the idea to do us, and because it's not like we can go out and do it. You know what I'm saying? I don't know how expensive it is or inexpensive it is, but I know we can afford it right now. So it's a blessing. It's great.
7 days a week we do screenings of all the guests coming into the shelter, why we do this and how we help minimize the spread. Mostly it is a support to the shelters, also to those individuals that are coming in every night, to give them a little more confidence knowing that everybody's being screened. People with symptoms, typically we're recommending they wear a mask. All of those that have presented in the shelters with symptoms, none of those have tested positive to this day.
So being out here allows us to build that relationship, working collaboratively to get them resources, to get them stronger, to get them healthier, to make better decisions. So this time that we've been out here, these 8 weeks, they're almost nightly, we've been working with them to establish that opportunity, to build that trust and relationship. It's not one talk and you come in. It's several, sometimes as much as 20 and 30 contacts with individuals before we can get them to engage and come back into the system so that we can get them some wraparound services. It's slow work, it's methodical work, and it cannot be done really any quicker because it's person by person. So we have to figure out how to make this work through private and public partnerships, through community-based organizations, and through our faith-based partners. It's easy for people to raise their voice in anger. What I need people to do is find solutions and work collaboratively with us. Otherwise, the problem will persist.
It is important to look at the future and see how we can really come together as an entire team and not just one person at a time coming in, doing their thing and working in silos.
By working together, collaborating together, and finding solutions, not screaming, not yelling, not pointing fingers or blaming, but solutions to help people, we can fix this. But we're going to need everybody working together.